Good evening, friends. Let me talk to you today about the commonest problem. Sometimes it can be a rare problem also. What is that? Chest pain. Chest pain can occur in a variety of conditions. The commonest causative factor that one thinks when I speak about chest pain is heart attack, and heart attack. Not all chest pains are originating from heart attack. There are so many other causes, physical causes as well as psychological causes. Let's try to understand these common causes. One of the common conditions is what's called as angina. Anginal pain occurs when there is a reduction in the blood flow to the main artery of the heart, coronary artery. When there occurs a reduction in the blood flow to the heart muscle, it causes pain. How does the pain feel like? It feels like a heaviness, a pressure in the chest, often triggered by what? Triggered by exertion. The person will be climbing the stairs or walking an uphill task. Suddenly he might get pain. Then he might sit for some time. He might take a rest for some time. This pain gets totally relieved by means of rest. This is what's called as an anginal pain. Next is about heart attack, myocardial infarction. The pain is very severe, very excruciating, very unbearable in nature. Not only does the pain occur in the chest or behind this bone, but sometimes it can get radiated to the arm, to the neck, to the little finger, etc. It can get radiation to your jaw, to your teeth, to your back, to your neck muscles also. If the pain is very severe and if it's accompanied by, say, breathlessness, like that, or vomiting, if the pain lasts for more than 15 minutes, make it a point to visit your cardiologist immediately. Don't defer, don't postpone. There is one more condition which is called as pericarditis. What happens in pericarditis? There is a sac around the heart. If that sac gets inflamed, inflammation of the sac around the heart, it is called as pericarditis. That also can cause severe pain, my friends. What is the characteristic of this pain? Pain increases when the person lies down and improves on sitting up. Pain exaggerating on person lying down and improving, getting ameliorated, reduction in chest pain on sitting up. Think of pericarditis. Inflammation of the sac around the heart musculature. There are certain lung-related causes also which can produce pain, chest pain, pneumonia, pleurisy, pulmonary embolism. Pneumonia, pleurisy, pulmonary embolism can cause chest pain, sharp pain with cough, fever, and sputum. Sharp pain with cough, fever, and sputum. Think of pneumonia. Pleurisy. Pain worsens when the patient coughs. Pain worsens with cough or with deep breathing. Think of pleurisy. Chest pain, rapid pulse, sudden breathlessness. Chest pain, rapid pulse, sudden breathlessness. Think of pulmonary embolism. It's a rare condition, but an emergency, an acute emergency due to the blockage of pulmonary artery, acid reflux, GERD, GERD, or esophageal spasm or ulcer. That also can produce severe pain. These are gastrointestinal causes which can produce pain. Many people say, "Sir, I had acidity, hence I had developed severe chest pain." These are two gastrointestinal causes which can produce severe excruciating chest pain, my friends. Then costochondritis, muscle spasm, muscle strain, costochondritis. It's all due to the muscle and bone causes. That also can produce chest pain. After exercise, after lifting, or after stress, Some people develop severe muscle spasm and it can lead to severe chest pain also. Next, of course, the more common condition of chest pain, which general practitioners or family physicians encounter in routine clinical practice. Not only general practitioners, cardiologists, they also encounter such cases of chest pain. What are these causes? Cardiac neurosis or anxiety, tension, stress, somatization. That also can produce severe chest pain. The vicious cycle. Patient complains of chest pain, runs to a cardiologist, cardiologist does an ECG, ECG is normal, treadmill is normal, echo is normal, person comes back, but next day again he has that thought repeatedly in his mind that this pain is due to my heart attack. Again he rushes back to cardiologist. This is what's called as cardiac neurosis. It's a vicious cycle. Doctors have to nip it in the bud, lest it grows into a huge mammoth banyan tree. We as psychiatrists encounter lots of cases of chest pain emanating from anxiety, herpes zoster, aortic dissection, hypertrophic cardiomyopathy. These are rare causes of chest pain. What happens in herpes zoster? There is severe burning chest pain before a rash appearing. Think of herpes zoster. Severe burning pain, tearing pain rather, radiating to the back. Very severe pain. A true emergency. This is what's called as an aortic dissection, causing severe chest pain. In younger people, chest pain seen during exertion, during severe exertion in younger people. Chest pain seen during exertion in younger people can be due to hypertrophic cardiomyopathy. A leak in the lung can produce chest pain. Diagnosis pneumothorax. Post radiation also. People receive radiation due to cancer. Post radiation neuralgia, as we call it, as very common disorder nowadays with urbanization, industrialization, with the advent of so many things in scientific field. Unfortunately, cancers are on the rise. Cancer patients, more often than not, they receive radiation, and post-radiation people can experience severe chest pain, my friends. Certain drugs, particularly drugs used by psychiatrists like SSRIs, fluoxetine, sertraline, they also cause severe chest pain. One has to be very cautious in distinguishing whether chest pain is originating from physical cause or from a psychological cause, or is it idiopathic in nature. When I say idiopathic, it is induced by means of therapy, by means of treatment of doctors, not intentionally. No doctor intentionally causes any pain, but adverse effects of medications. It can make one suffer from all these problems. It's called as an iatrogenic disease. This I'm telling because apart from doctors, many non-doctors also view this YouTube video. When should you rush to an emergency room? The chest pain lasts for more than 15 minutes. There is severe breathlessness, dyspnea, nausea, vomiting, pain not getting confined only to your chest, but it radiates to the back, neck, teeth, jaw, left hand, etc. Rest to the doctor, rest to the cardiologist immediately. It can be a heralding symptomatology of either a frank heart attack or an impending myocardial infarction also. Especially if you are above 50 years of age, you have got diabetes, you have got hypertension, you have got high blood pressure, and you are fat, you are obese, you are leading a sedentary lifestyle, you are not exercising at all. In such conditions, this chest pain can be a symptom of a myocardial infarction or heart attack. All chest pains are not cardiac in origin. But as I told you, few symptoms like pain lasting for a longer duration of time, not getting relieved, accompanied by breathlessness, vomiting, any family history of heart attack, and if you are a diabetic, if you are hypertensive, you must think of these myocardial infarction as a possibility. This is not the commonest cause, there are other causes also, but do think of this possibility. Prevention is better than cure. What cannot be cured must be endured. So goes an English adage. Try to prevent things, try to prevent catastrophes. The remedy lies in that, my friends. The cardiologist will make an appropriate diagnosis. You may order an ECG, an echo, a treadmill, or a stress test, stress thallium test, or a conventional angio, which is most pathognomonic, which is most diagnostic. The cardiologist advises these investigations, never refute it, never dismiss it as that. So, what will happen to me? This is subconscious denial, unconscious denial. Please pay respect to the words of the cardiologist and follow his suggestions appropriately. Wish you all a very healthy and very safe heart, my friends. All the best. Thank you for watching. God bless you. Please do share the video.